I am Sanjana Malkreddy, and today I'm thrilled to be joined by Dr. Vidya Kollu, a double board certified hematologist and oncologist, and also the founder of Arogya Vidya, a consulting service focused on cancer and blood disorder care. She also founded the LinkedIn community Empower IMG, which helps international medical graduates navigate the US residency and fellowship application process. To really understand Dr. Kollu's journey, career, and ventures, we will be doing a few episodes. In this first one, we're focusing on how she got into medicine and what her job as an oncologist is like. Okay, so let's start by going back to the beginning and learning a bit more about what inspired you to pursue a career in medicine and how you got to where you are today. Okay,
Uh,
the first question is, what initially sparked your interest in medicine, and was oncology something you were drawn to early on, or did that come later?
okay. Hi, Sanjana. Thank you so much for the warm introduction. First off, I want to say how truly honored I'm to be here on the Medicine Community and Research podcast. What you're doing, creating a platform where real stories, experiences, and lessons are shared, is so needed, especially for young students and professionals who are just beginning their medical journey. So, thank you for the opportunity and for holding space for these meaningful conversations. So, getting to the question of what sparked my interest in medicine. So I think my path to medicine was written early, almost literally when I was 3 years old. I suffered a serious accident where I had like severe scalp burns that led to 1 year of absence from school. I don't remember much from what happened at that time, but as I was growing up, my mother always used to tell me, like, you were saved for a reason. You were brought back to life because of the care and effort of your pediatrician, who used to be Dr. Anjal Reddy from like a town in Kamareddy. And that story stuck with me. And even before I understood what medicine meant, I knew I wanted to be someone who could bring healing, like my pediatrician. And that belief turned into a calling. And I initially wanted to be a pediatrician, but during medical school rotations, I realized I love playing with kids more than treating them when they are sick. So I pivoted to internal medicine, which felt like a better fit for how I wanted to contribute and still help people heal. Um, and getting to the path of what the path it took to become an oncologist. So after graduating medical school, I completed 1 year internship in India, where you rotate through all the specialties, which you typically do here, like as part of residency, whereas we do that as part of a medical school training. And I faced a major crossroad whether to pursue a postgraduate training within India or apply to the US, but I chose US with a lot of other factors being considered. And after a lot of contemplation, I applied for residency and matched on my first attempt after like graduating from medical school. And my interest in oncology began during my second year of medical school. I met a young woman who was actually in her like 40s at that time, diagnosed with pancreatic cancer, and she was devastated. And at that time, I didn't know much about cancer, how it's treated, and all, being a young medical student. But I knew enough to feel helpless, but I was there to emotionally support the patient. Like, I used, outside of my rotation, I used to go visit this patient and, just give that emotional support. And that that helplessness, I would say, kind of became a deep curiosity and drive. And I wanted to understand more about cancer, and not just the biology, but also the people, the systems, the stories. Especially, I'm very much drawn to the stories that these patients bring to us. And then came another personal turning point. My grandmother, I was the one who happened to diagnose her with breast cancer when I was in third year of medical school. And I was the one who pushed for testing, navigated her treatment, going through all surgery, radiation, and chemotherapy. And that sealed it for me. I knew oncology was where I was meant to be. And that's how I applied for internal medicine residency and matched. And yeah, and that's what led me into oncology.
That's really cool. First of all, it's nice to meet you, and it's so cool for you to be here on this podcast with here for us today. And it's also really cool how you channeled your experience and were able to make a little career out of it. And it was really nice how it actually fueled you, like to be passionate more about your patients and things like that. Okay, now that we know why you're interested in medicine and why you especially chose oncology as a future career for yourself, can you walk us through the path that you took to become an oncologist?
Yeah, so during internal medicine residency, like you tend to do like a focus on like most of the internal medicine aspects. But I was also being proactive, trying to get some work done within the subspecialty of oncology, like doing the rotations and attending the tumor boards and being part of the cancer center research trials and helping out with the oncology team. And I did whatever I could with a busy residency schedule to try to get some scholarly activity like presenting posters and things like that. And I did apply during my second year of residency for fellowship. And at that time, my residency program didn't have a hemonc fellowship slot as they didn't have the training for that. So I had to apply elsewhere. And usually it's typically like, programs tend to take, internal people and like, and also hemonc being a competitive specialty. I didn't match the first time. So I decided after completing residency, I'm gonna, improve further on my CV and reapply. So I didn't just necessarily stop there with the first rejection. I still went on to work harder to build my CV. I worked as a subspecialty hospitalist in the bone marrow transplant, where I could get further exposure to oncology, like see the inside of like the day to day, and further see if what kind of career path I can choose, using that as an opportunity instead of a limitation. So I worked for 2 years at University of Iowa, and then I went on to work as an oncology hospitalist at Fredet, considering the recommendations from my mentor to that would be the right place to be to get into the fellowship. And eventually I did a lot of more research, built on my CV, worked on my networking, and I matched in 2018 in Hemonc, and I then trained at Gunderson for my fellowship. And yeah, that's the long story, but overall, every step, including the delays, I think added clarity and resilience to my journey, and it made me value, the a struggle, like as any human go through, right? Like because in
Yeah.
oncology, what we deal with is people struggling through difficult diagnosis, and it gave me a kind of a silent strength to empathize better, understanding the struggles and solidifying my resolve to be in oncology. So
Thank you so much for sharing your journey. It showed how, like, just because you got rejected doesn't mean you stop doing what you're doing. Instead, you actually push through and you continue what you want to do. So you can do whatever you want to do with your career and stuff like that. So that was really cool. So when you figured out you got rejected, did that like have negative feelings on you, or did you like push through? You were motivated to do better or anything like that?
to answer that question, I can say how I felt at that time, like versus what I think about it now after
Okay.
going through that experience almost 10 years ago, right? So at that time, yeah, I did feel rejected. Like, why, like, I was like, oh, I'm doing everything that is needed to apply for this. And also, I know there were some things that were out of my control, like, the visa status. I was on a visa because I'm from India, and that makes it more even more competitive to get into the specialty. So I had that understanding, but at the same time I knew this is the specialty I wanted to be in, and I let that motivate me instead to do better and to further work on my clinical skills, which wouldn't have been possible if I had directly matched into fellowship.
Yeah.
And the things that have helped me in the process was having the right mindset, right? Like, something to understand in life, as I realized over time and with maturity, is that not everything happens for a reason, and life has a plan for each individual, right? And
Yeah.
maybe that was the path I needed to take to be the physician and the person I am today, than if I had got directly into fellowship, which could have been easier but not the best possible destiny for me. And the things that helped in the process, along with having that understanding and mindset, is also having the right support system. And I leaned on to, like, talking with my mentors and other colleagues who were going through the same process, and making sure I was not just dealing with more negativity, or thinking, oh, this is it, and I'm doomed or whatever, but instead used it to further push myself through, and not just push myself through, but I also pivoted. I made an assessment of what was working, what was not working, and I took control of what was in my control and let the other factors, which were not in my control, play the part. But and being patient through the process, right? I believe in the thing that, like, God's delays are not necessarily denials, and it happened for a reason. But there were a lot of other things that help me push through the process, and being strategic and intentional about the direction I was taking, even during that process. And I appreciate whatever struggle I had to go through at that time. Now, like, after I'm already in oncology, and I get to see what I see, that experience, like working in, like, let it be bone marrow transplant or as an oncology hospitalist, that added another layer of sophistication to how I can manage and treat my patients better. So
Yeah, that's really insightful. Like how you took one like moment that could have like, prevented you from achieving all this, but instead you bypassed that and let it fuel you. Like, and then you learn like some meaningful life lessons from it, and that's really cool. You also previously mentioned something about a CV. Can you please explain what that is?
oh, it's the for, like, application, right? Like, you cite all your experiences, and like work experience, and like research publications, like the basic curriculum vitae. And for residency and fellowship, it all comes down to the clinical or research experiences that you have had over the period of time. And also, kind of that speaks for the work you have done outside of your credentials, like you get your scores and all, which is the standard for everyone, right?
Yeah.
But with the building the CV, you kind of add more details of, like, what passionate projects in medicine, within medicine, or outside medicine, that kind of brings out your personality in that sense. So yeah.
Okay, that's cool. That was good to know. And also, were there any like key moments or turning points that really shaped your direction? I know you previously mentioned your grandma earlier on.
Mhm.
Can you elaborate on that or share another experience?
So that was the first incident. And when I was in residency too, I did that solidified, right? Like, I took care of this young patient who was like in his 20s and was diagnosed with Kaposi's sarcoma that was related to HIV AIDS. And I took care of him in the ICU. And he, though he did not have great outcomes given his medical condition, but that kind of I could say I was there, like, even at the time, like, he was coded, and we could not bring him out live. But the moment I kind of debrief what happened to the family that came over, like, he was an immigrant from Mexico, was in the US. And when I was debriefing what happened, to the family, the mom, the uh, the though we didn't have great outcomes, the fact that they do appreciate, all the
Yeah.
effort that goes into taking care of the loved ones, that what was one of the initial experiences that led to, kind of uh, mm, make me further solidify my intention of becoming an oncologist, because that's how I wanted to practice medicine. Like, and I couldn't see anything else beyond, like, having that patient physician relationship, and not just being able to use this practice the science of medicine, but also the art, and kind of relating to patients and families on a more uh, uh, deeper level, and understanding that human connection in the broad scheme of things, and all that. And the fact that the another key moment, or the turning point, I would say, the fact that my fellowship, my residency program didn't have a fellowship slot, that kind of also was an interesting challenge I had to overcome, and made me lean in harder. And as I said, I pivoted, like, work, like taking the subspecialty hospitalist role, and, like, took on research, and I did some translational investigation coursework and gained more experience in oncology. So those were all, and all the patients I've seen through that process, and the families that I was able to help, kind of made my why strong. Yeah.
Were these experiences, or did they also encourage you when like times were tough, or like when you felt like giving up or something?
Yeah, and absolutely, right. And there will be those days. It's not everything is like, like all rosy, but there
Yeah.
will be some difficult, hard days, especially being in medicine with all the heavy stuff you deal with. And that why, like, why I'm here in oncology and all that experiences, kind of helped me realize, like, okay, I know why I'm doing this, and this is what I choose to do. And it also helps to have that experiences to, further build on
Yeah,
more
for sure.
meaningful experiences. So
Okay, so our next question is, so I previously mentioned that you were a board certified hematologist and oncologist. So what specifically drew you to those fields as opposed to another medical specialty?
so the question here is about, so what specifically I do in hematology and oncology compared to other
Uh,
fields.
Not quite. It's like what drew you? Like why did you pick these two fields among all the various other healthcare jobs?
Oh, among all the other healthcare jobs.
Yeah.
Oh, yeah, and it comes down to the fact that I was gonna be able to, both master the science, like, like hemonc. It's ever changing specialty with all the new research that goes into bringing like new treatment options for patients affected with these conditions. So that's one aspect, because I'm like in general a very curious person. I'm more cerebral, like, I like learning and knowing about things, and going into the depth of how things work and why they work and all that. So the science part of, like, being able to use all these new treatments in like different conditions, the science part of it. And as I mentioned, the part of having that patient physician relationship, which goes beyond, just an appointment or a visit, and it kind of, you travel with the patient through their most difficult time of their lives, and in you can make a difference in, like, the outcomes and all that. And though there were other specialties, right, I could have been a pediatrician as I thought, but over the time period, like, the experiences have taught me, like, what I really like, practicing versus what I think, I like. And in terms of why hemonc, I think it's the uh, perfect blend of using science and practicing the art of medicine, which draws me towards it. So.
It's actually really nice to hear that you were thinking about becoming a pediatrician when you were younger, but then as you like pursued medical school and all that, and as you gained more experience in the medical field, like all these experiences that you encountered shaped what you wanted to be into not a pediatrician, but an oncologist and hematologist. So that's a
And
nice
for adults. So,
Yeah, that's a
yeah.
nice way of knowing like whatever you decide one time may be different in your future, depending on the experiences you go through. Okay, so now that we heard about like how you got into oncology and hematology, I'd love to get a better picture of what your day-to-day work actually looks like. So can you please describe what a typical day in your job looks like?
Yeah. So as a hematologist oncologist, no 2 days are exactly alike. And that's what makes it more interesting. I don't like the monotony of things. Like, I
Yeah.
like things to be, different, but they're always full. So a typical day involves patient care, which is the heart of what I do, right? Like, you consult with new patients and you follow up, with patients on treatment, and you have to, reveal the bad news, good news, and all that kind of stuff with the patient care. Um, and at times there are some procedures that come along, like doing bone marrow biopsies and, managing the infusion plans for chemotherapies and the treatments that patients are going through. And the other part of the typical day is mainly the documentation and care coordination, because a lot goes behind the scenes, to ensure continuity and quality of care. And especially, it takes a village to manage a cancer patient with a lot of specialties involved, like let it be primary care, surgery, oncology, radiation oncology, and like say intervention radiology for some other procedures that we don't typically do in the clinic. So it takes that care coordination and attending tumor boards, and where tumor board is a place, it's a meeting where multidisciplinary team meets to discuss the oncology patients and their care plans. And and other than that, there is also part of some teaching involved, depending on the day and schedule, where you have like medical students and residents, depending on the place, where you'll be working, that you get to, teach them and all that. And usually a typical day starts, again, it depends on how you schedule your work and depends on the setting you're working in. Like I have worked in all settings, like academic, community settings, and right now I'm working for myself, like where I'm like self-employed, working as a locum independent contractor. So where I get to choose my timings. And again, like as much as I'm an oncologist for my day job, like I'm also a full-time mom. So I schedule my work around and start my days typically around 7:30 and try to end them by 4:30, so I can still be there for my kid. But the typical day involves a lot of patient care, and even in patient care, it's not just the consults and visits you do, but it also involves addressing any complications that are coming on during the treatments, and taking calls and questions from patients and families, and working with a team that helps support cancer patients, like working with the medical assistants who room the patient, and the nurses, the chemo trained nurses who infuse the chemo, and the care coordinators, like who help patient navigate through different phases of their cancer journey. So that's my typical day.
Can you explain how well communicating is between all healthcare professionals involved in one patient? Because from what you said, it seems like there's like a lot of people involved. Can you explain if that communication is like direct, or if you're like, like messages take too long between people or stuff like that?
So the communication in oncology, especially with where everything is crucial and needed to be done the right way and at the right time. So it's mostly direct, especially with the immediate team, right? Like especially in medical oncology, the team includes the oncologist, the nurse, the pharmacist who mixes the chemo, and the chemo nurse who administers the chemo, and it's a direct communication. And usually you work with a team that is assigned, like you have your own chemo nurse, and like the nurse who does all the teaching, and the MA who rooms your patients consistently, and you kind of build a workflow around how you approach different patients based on the diagnosis and all that. And the communication is mostly direct within this in immediate team. And when it comes to communication related to any ongoing changes during the treatment course, we use like mostly the EMR, like where you have like all the secure messaging and all that, where you kind of communicate written communication to, and sometimes it's verbal communication over phone, and with other members, right? Like say radiation oncology and other specialties like surgery, or other procedural specialties like GI or pulmonology. It's mostly in the tumor boards, where we discuss a patient, and like everyone from the specialty gives their input on what needs to be done. So that's a form of direct communication there. But along the treatment course, again, it could be a phone communication or communication through the EMR, if anything changes, and if anything else needs to be done for the patient. So it's we use different forms of communication to make sure we get things done for the patient in a timely manner. And again, that's where you're also trained during your training to prioritize what is important, what is not, and what needs to be done when, and all that, and that you learn as part of medical school and residency training. But yeah, and communication is key in ensuring the patients get what they need, and to make sure everyone is on the same page with things like cancer diagnosis and treatment, which is a very complex. Yeah.
Can you also explain any procedures you may do or be a part of?
Yeah, and the main procedures we do as hemoncologists, The main one, being the bone marrow aspiration and biopsy, where it's usually a clinic procedure that is done to help diagnose an underlying condition like blood related disorders or any in sometimes even some oncology conditions like blood malignancies and things like that. And the other procedures that we also do, and not so frequently like the bone marrow biopsy, would be something like lumbar punctures, where you get the CSF fluid, the fluid in the brain, to like get some workup for diagnosis, and we administer intrathecal chemotherapy, which is again putting chemo into the fluid in the brain based on some conditions. And the other procedures, the common one being like we do a lot of infusional treatments, right? Like most of the chemos, in addition to the recent oral and all that, it's mainly infusional based. And chemotherapy is something that not every provider can give. It has to be like supervised, and that's what is a major part of our role in determining the right dose and right route and the right schedule for the patients and coming up with that infusion plans. And also the other treatments like immunotherapies and those are also can be considered the main procedures, if we may call that. And the other things we tend to do is not so common, but we are trained, is to put in like central lines, like having catheter access for chemo administration. But we usually rely on intervention radiology team to help with that, because our schedules are usually so full, like trying to see new patients being diagnosed with cancer and following for the treatment plan, where we try to offload any unnecessary procedures, which can be supported by the intervention radiology team, who do a better job and are more effective in getting patients through. And the other procedures we do is we also like look at the smears, like interpret the conditions like blood conditions like leukemias and things like that, and interpret like all the pathology reports of flow cytometry and the stains, and more of the next generation sequencing testing that is done in different cancers. So it's more I would say, in the sense of procedures, it's more a cerebral procedures, like in terms of coming up with all the infusion plans, than the hands-on, where like more like bone marrow biopsies. But it's a good mix of it's not just um, seeing patients, but we do get my hands-on, like getting some procedures. And typically, I've noticed that like early on in my medical training, I used to love doing procedures, like putting lines, central lines, arterial lines, and all that. And over a period of time, once you learn it, and that's also decides what specialty you want to go to, right? Like if you're a more hands-on person, you want to be in more a surgical specialty. Whereas the beauty with internal medicine is you still get to do a lot of procedures. And sometimes, if not for hemonc, because I was also internal medicine trained, I used to also do like paracentesis, where you take out fluid from the belly and you put some needle in the chest to take some fluid that is accumulated around the lungs and things like that. And biopsies, like all those biopsies that was part of the general internal medicine training, and pap smears and things like that. But in hemonc, it's mainly specialty focused, like bone marrow biopsies and CSF, like IT chemos and things like that.
So, from what you mentioned now and what you mentioned previously on, it's like oncology seems like an emotionally demanding job. So,
Mm-hmm.
how do you like navigate through that?
So it's hard, no question, because you witness some of the most vulnerable moments, right? Like there is grief of, being diagnosed with cancer, there is loss, and also there is grace, resilience, and gratitude that you learn from the patients that go through this. And over the period of training, like initially, when you start versus, when you're trained, the difference is that you're taught and you learn how to hold space for both, like being fully present for the patients, because you need to make sure you're not overwhelmed with just emotion. You need to come up with a right treatment plan that help them. And then also it's important to step away to recharge, right? So, and that's where like you need to have a good work life balance of like, yeah, you cannot pour for an empty cup, right? Like it's emotionally draining you, because you give so much to these encounters and making sure you're giving the hope and the needed guidance in these difficult situations. But you need to fill your cup somewhere else. That would be in life, right? So it's important to make sure to recharge, and that could be different forms for different people. But for me, it is mostly meditation, yoga, and reflection, and also exercise. I feel like after a heavy day at work, like if I go work out and lift that weights and get that emotion out is very important. Otherwise, it can stay with you, because like we are all human beings and we hold on to certain emotions. And also it's important to have some passion and hobbies outside of medicine, right? Like treating heavy patients. And that's what I do, like as part of like Let It Be Empower IMG, where I help guide international medical graduates applying for residency fellowship. And I also have a variety of stuff that I do outside of medicine that keeps me emotionally, recharged, like not just all into dealing with the heavy stuff, like investing and like financial education and all that stuff, which kind of helps with the emotional regulation and makes me full to go pour in more. And the other thing that I have been enjoying recently, especially being also a mom, is spending time with my 5-year-old, who brings that uh, uh, emotional recharge kind of situation to me, like just spending time with kids and being in the nature and all that. So it takes different things for different people, but these are the ones which help me balance emotionally. And the one important thing that helped with all this is sometimes it's important not to just get overwhelmed with the emotions that are thrown during these encounters. It's important to address that emotions, and as part of the training, like we go through that's also part of the training that is important, not just the treatments or the science of it, but also they teach you how to handle difficult emotions and all that, because handling them well during these encounters help you manage overall like the effect of it, so where you can navigate it like better than being lost in emotions. So the training that goes into deal with that. And there are a lot of resources, like if anyone is interested in general to how to deal with difficult emotions, like vital talks training is one part of what we go through as how to handle this.
So are there any like patient experiences that help to like emotionally recharge and like pushed you to continue your career and stuff?
Yeah. So, and the thing that we are blessed being in oncology, and that's what keeps us doing what we do, is that at the end of the day, you have the satisfaction that you have really helped uh, the person and made a difference in their lives. And as I said, right, it's not just all in sense of, yeah, there are a lot of instances where you are able to cure people from certain kind of cancers, and you can see they go on to have like normal healthy lives compared to what they were before coming into the treatments and all that. But at the same time, there are instances like where you deal with some, say, stage 4 cancers, where the end is eventually they succumb to the cancer, right? But in spite of that, the how much the patients and families appreciate what you bring to the table to help them navigate these scenarios. And one particular that experience that stands out to me, it was in fellowship. I was in training, and I was taking care of uh, a young patient. I would say she was less than 50 years old, and she was diagnosed with a metastatic cancer. And I took care of during my fellowship years. And when I was also uh, pregnant with my kid at that time, like during training. And it was so kind of the patient and the family, like when I came back from my maternity leave in 6 weeks after I had my kid, when they came for their appointment, they kind of had this kind gesture of like, again, being in a foreign country and not having much, social support system, and you don't even have the time to build that social support network. They were so kind enough to like bring all this cute kitty clothes and things for my kid. And I remember, and eventually I was part of all her cancer journey, and eventually we lost her to cancer and like during the end of my fellowship training. And the way, like all and I was there for like, went to the funeral to give it a closure to the family and all that. So so these kind of experiences kind of, are kind of more of a non. And at the same time, not all the time the outcomes are, going to be how we expect, and there can be some difficult outcomes too. But in spite of what all that happens, most of the times it's like, rewarding for, and people do appreciate for, what you do to help them live longer and get healthier in spite of not having great outcomes. And of course, you have those instances where people are cured and they're like, living so much better lives, and are different people compared to what they were. And not just with the oncology, right? Even with hematology, the most common thing I see, like I manage help iron deficiencies, right? That's part of the hematology. And you see these women who are like so tired and slogging to get through their days. They feel like they have this new life if I treat them with iron and they get better. So it's a spectrum of like, all kinds of things and like different outcomes and different experiences, but it's like rewarding towards the end. So
Yeah, I think that's like one of the best thing about healthcare jobs is like it's the rewarding aspect of it. Seeing your patients or residents or whatever improving and doing better than when they came in. I think that's one of like the best things that can happen in healthcare jobs as well. Yeah.
mhm.
And you also worked, so we know that you worked in clinical setting, being an oncologist and hematologist, and you also do telehealth. So how do those two compare?
Also, the main thing with the clinical thing with the, like, it's more in person, right? I'm there, like, and all that. Whereas telehealth, it's something I do virtually. So and the telehealth platform I have created, it's mainly for providing like second opinion services for patients and families navigating cancer diagnosis in India. And because uh, it's more virtual and it's on a schedule like that works at my own pace. Like even like not, right now I'm traveling and I was able to get a consultation in through the virtual platform. And it's different workflow because the one I do as part of my day job, like where I'm part of a cancer center team, right? And where I don't run like the admin stuff and things like that, where everything is like already taken care of. All I need to do is just go see the patients, get the documentation done, and rest of the, and we have a big team, kind of to make sure that all the steps happen and fall in place for managing patients. Whereas with the telehealth that I'm doing as part of my own, like it's more an entrepreneurial venture, like to provide the services to folks in India to get their questions answered. It's more a guidance service than, I don't prescribe treatments, or I don't, prescribe chemo to minimize the complexity. But I do review the reports, which they, download through different platform, then having it in the EMR. And it's still like I get to review them and interpret them and educate them on that. That still stays the same, but how you do it is different, like as part of my day job versus the telehealth platform. But the beauty of the telehealth is the flexibility and the ability to open services to people who would not otherwise have access to, right? So that's what I would say. Yeah.
I just wanted to mention that the telehealth platform I was talking about was Arogya Vidya, which is what Dr. Kollu created as a consulting service focused on cancer and blood disorder care. And we'll talk about that more in depth in the next episode. And that was actually the last question we had for this episode. So thank you so much for joining us.
Mhm.
And so this wraps up episode one. And in the upcoming episodes, we'll dive deeper into Dr. Kolu's experiences and explore her advice and tips. for those aspiring to pursue a career in the medical field. So thank you so much again, and I'll see you next time.
Yeah, thank you again, Sanjana, for inviting me and for starting this much needed podcast. Yeah. And if just one student listening today walks away feeling inspired or validated, then this conversation has been worth it.
Okay, bye-bye.
And to anyone listening, your journey won't be perfect, but it will be powerful if you stay connected to your values, your community, and your heart.